Welcome to Thrive with Pride from Age Options, an online space for LGBT plus older adults and those who care for them. This month, we welcome Dr. Elliot Montgomery Sklar, an associate professor of health science at Nova Southeastern University in Florida, who led a discussion about is caregiving different for LGBT plus caregivers? This is a recording of his introductory remarks to the live discussion held on Zoom. The discussion that followed was not recorded. Welcome, everyone, to our March Thrive with Pride event. We're very happy to welcome Dr. Elliot Montgomery Sklar today. Dr. Elliot Montgomery Sklar is an associate professor of health science at Nova Southeastern University in Florida. He has worked in various roles to support students and to promote the health of communities through research and practice for over 2 decades. As a regular presenter for the WellMed Charitable Foundation's Caregiver Teleconnect, he has worked to help caregivers across North America by connecting them with information and resources. His areas of focus and expertise include health promotion as we age and addressing the needs of diverse caregivers as our overall population grows older. Elliot is an expert in issues addressing aging in the LGBTQ community, men's health, and has published and presented his work internationally. And we're thrilled to have Elliot here today to talk about is caregiving different for LGBT plus caregivers. Elliot, we'll turn to you.
Thanks so much. And after our formal presentation, I really look forward to having a conversation with everyone and to learning about your perspectives on this issue. But I think that we can pretty much agree that we do live in a heteronormative society, and caregiver programs are also quite heteronormative. And as a health educator, I saw an opportunity several years ago for us to design programs that were more sensitive to some of the different issues that LGBT seniors and caregivers experience. And so each June, I am privileged to co-host a series called The Pride of Aging for the WellMed Charitable Foundation, which focuses on current issues that are of importance. And as a person who does research as well, it was very interesting to me to see how limited research there really is in only one major national organization that was advocating for LGBT seniors, which is SAGE, an organization based out of New York. And that stands for Services and Advocacy for GLBT Elders. Because back when SAGE began, we didn't use acronyms the way that we do today. And if you did a Google search today, as an example, and looked up news and hit the word LGBT, you'd see a lot about political tumult that we're experiencing, I think, as a country. But if you looked a little bit further and used keywords LGBT caregiver, you would see even more upsetting news, mainly, again, about inequities and challenges that LGBT caregivers are facing in our country. And many people are curious about this topic because they can't really identify why caregiving might be different for someone who is part of the LGBT plus community. But I believe that it is, and that's for two main reasons. The first one is that we have unique life experiences, and incorporated in that are unique experiences with healthcare. And the other reason is that gender makes a difference for caregivers' experience, because caregiving is a gendered role in our society still. It's something that's seen as feminine. And again, I love looking up imagery in Google to reflect back. And if you did a Google search and you looked up images with the term caregiver, you would mainly see women in that role. So if we look at the life experiences and traumas of seniors today, one of the main things that we hear is that surviving requires a level of energy that doesn't really allow for future planning. So as an example, many people who were HIV positive thought that they were not going to be here today. I recently spoke with a 77-year-old man who was diagnosed with HIV in 1996, and at the time was told he only had a few months to live. Well, here we are in 2023. And he's undetectable, but he's struggling to make ends meet because he had stopped contributing to a retirement savings account a long time ago and only resumed saving when he was about 60 or so and in good health, realizing that he might have a future. And unfortunately, his situation is not unique. A lot of current rhetoric about law and religion includes political bills referencing things like don't say gay in schools and restricting healthcare access for trans youth. And these things can be very triggering and can make people feel unsafe. Some seniors who identified as LGBTQ plus in research had said that they felt like they have to go back in the closet if they had to go into a long-term care setting. And I think when you hear about some of these news in some of the states where this is happening, I think that concern is very real. So I think as a result, it wouldn't be surprising if members of the LGBT plus community feel a little less comfortable right now in seeking out healthcare or seeking out social support or services. And we need to remember too, and this is something I think about a lot because the Caregiver Teleconnection, the program that I was speaking about earlier, was in part created to reach rural caregivers. A lot of caregivers live in rural areas, and some of them might live in Tennessee, for example, where drag shows were just banned, or even rural Tennessee for that matter. So I try to keep perspective. I live in a big city, and I've been with my husband for 18 years. And yet every year at my physical, I'm asked about getting an STI and HIV panel through my provider. And I've been a patient for 8 years, and my doctor knows that we're monogamous, and every year I decline the screening. I thought it was just standard practice until other people I know who are not gay and who see the same provider and who are not in relationships do not get asked about STI panels or HIV tests. We're coming out of the pandemic, I think, as well, which was a time in which we were reacquainted with certain inequities when it came to blood plasma donation. And gay men in New York were not permitted to donate because of longstanding policies about blood donation from early days of the HIV crisis. So I think some of these unique experiences with healthcare change our experience and viewpoint about caregiving and about receiving healthcare as we age. So if you think about someone who was born, and just for ease, we're in 2023, so let's just say in 1953, that person is today 70, and they were 19 when Stonewall occurred, 23 when the American Psychology Association removed the diagnosis of homosexuality as a mental disease or disorder. That person was 27 at the beginning of the HIV epidemic, and 63 when gay marriage became legal on a federal level. So that to me is quite profound. And many people don't realize that the simple ability to get married legally was a game changer for caregiving and how we are, in terms of, for example, being able to take FMLA, Family Medical Leave Act benefits. This is a huge benefit that many of us don't really think about when we're younger, but it's critical when you're a caregiver. For example, another issue is hospital visitation. For people who even are married, many of us don't share last names. So, I certainly think it would be normal to understand where fear or concern, for example, over gay marriage is a touchy subject in our current political climate, especially for caregivers. And then I had mentioned gender issues and mentioning that we live in a society in which caregiving is gendered as a feminine responsibility or role. And if, again, you look at those images, men are barely visible. So many men don't self-identify as caregivers, and that can be one of the biggest challenges to being able to then get the right services and support that you need. Men are also more reluctant to ask for help and to discuss feelings. So for male caregivers, if they believe accepting help will improve the health or the quality of life for their care recipient, they might be more receptive. Whereas with women, women are more likely to put off their own health needs to care for someone, which has profound implications on women's health. So the gendered issues do make a difference too for LGBTQ plus caregivers. So what can we do? We can certainly plan. We can get paperwork in place like hospital visitation forms, living wills, creating a support network. We might also want to consider saving money, if we can, to support expenses that are related to aging, which include hiring help for caregiving if needed. And I think that we need to stay aware and vigilant right now of a lot of the political climate in which we're living. And because some of that triggers trauma, and that trauma doesn't go away if we don't deal with it. So for some people who might be avoiding healthcare or who have had negative experiences with healthcare in the past, it's important to find a safe space to talk about them. And a last point is that many of us are animal lovers, and we need to consider our pets when planning. For example, if we live alone and if we get sick, we need to think about a dog walker or someone who can help us look after our pets. So these are all very important things that I think are perhaps a little bit more unique to our community. And with that, I'm going to end this formal presentation and hope that we can open this up for discussion and sharing of experiences.
Thanks again to Elliot for opening and leading this discussion. Several resources and links were shared in the discussion. Please check the links in the video description below. If you are a caregiver, please reach out to Age Options for support. We hope that you will join us again on April 25th when Joe Smith from Mom's Mills discusses the importance and implications of nutrition and health and disease for older adults. Sign up for email reminders of future events at www.thrivingwithpride.org. Thanks for watching.